So we've now got much more savvy patients out there. People are more savvy. They're doing more research when their doctor tells them something. They're doing research on their doctors now. They're doing, they're asking for second opinions. That was a joke 30 years ago. Did you get a second opinion? Yeah, I asked them the next day. It's like, you're not, you didn't have multiple doctors. They trusted implicitly their doctors, their dentists. And then something happened in the last 30 years that something changed. Neil, how does that change now how people find their doctors and their dentists?
It used to be you implicitly trust your doctor, you trust your dentist. Dentists could have been doing more extractions than they needed to be doing or whatever it was. Now you have too much information. And so now you can look up a symptom of a toothache and you actually have cancer according to WebMD or whatever, or the flu or whatever. So that's a factor. And so my favorite saying is, there's way more information than there's ever been before, but there's this almost the same amount of good information or quality information. Mm-hmm. And so on the patient search side, I mean, man, that's completely changed. I think one of the things that ironically we're now moving back to is getting back to asking around, asking for people's opinions. The other thing that I think is really interesting is you talk about, people used to find practices obviously through things like the yellow pages or these directories. And I think that's where Google has really taken over. The interesting thing to me that I'm kind of exploring now and we're looking at is the platforms are pretty heavily influencing how people are searching for stuff. So imagine if the yellow pages was sentient. Well, that's kind of what's happening with Google, So imagine if the yellow pages had an agenda besides, which obviously they want to sell advertising, but Google wants to sell advertising, but they're not only playing chess, not checkers, they're playing quantum space chess. They're doing something, okay? And we're not even having the AI conversation yet, but I'll give you an example of this. So we walk through a lot of our clients a lot of the times about how Google Ads actually works now in 2024, okay? Because when people think Google Ads, I totally get it, but here's what people think when they think Google Ads. I'm going to search for something and then a result is going to show up at the top, right? And there's 3 slots, and I kind of know those 3 slots are kind of ads. And then they're like, when I scroll down, there's those organic listings, and like that's SEO, right? I'm like, yep, that's SEO. But now you get these map listings in there, and that started several years ago. And I don't know if you remember Google Plus, but Google was trying to compete with Facebook on the, let's call it B2C side, consumer social side. That didn't work out, so Google quadrupled down on what they do best, which is B2B. Google's like, screw this, we're not going to get in this space, but we are going to own businesses. Everything related to how you search for business, you find a business, that's what we do best. That's their lane of genius. I think it was one of the greatest decisions that they've ever made. Mm-hmm. They're also now quadrupling down on that again. What do I mean by that? SEO is still important, like Google search, so finding your website organically. But, I always tell people, like, your Google My Business is just as much of its own website now as your actual website. And Google's agenda is to make your Google My Business profile rank higher than your own website. Why? Because they own it. They don't own your website. They own your GMB. It's also really good for patients. I actually really like sort of that's happened because the general idea is all the Google My Business profiles are standardized. You've got, it's like writing a haiku. You've got the same parameters for everybody. And so there's pictures, there's reviews. Obviously, there's a lot of different ways to get, additional reviews. I'm still a huge proponent of that. We help our clients get hundreds of 5-star reviews. It's an important thing to do. But it is convenient. You can look for maps. You can see how close the practice is to you. You can look at hours all in one little, too long, didn't read, little blurb. It's been really good for attracting patients. And the thing that I always, keep in mind now is my kind of thing that I'm always thinking is like, if we can attract the moms, we can attract anybody. I have a saying, hell hath no fury like a suburban mother. It's true. If you can get the moms in there and the mom likes your practice, you can get anybody. You can get the dad, you get the kids. They don't care as much as a mom. The mom is going to read every freaking review you have. They're going to go on your Yelp. They're going on your Facebook. They're going everywhere. They're looking at everything. They're turning over every stone. And our response is, great. Be prepared. How do we get you prepared to do that? and it's not hard. But to answer your question, I think one of the interesting themes is sort of the way that the platforms are affecting how people search. Once AI comes into play, as it already obviously has, but I think that's where things get even more interesting. People can already right now just pick up their phone and say, hey, whatever, Siri, Cortana, find me a dentist nearby that does implants, find me whatever. So search is really completely changing. Even with Google ads, we talk to clients all the time and they'll be like, all right, well, I want to be at the top of Google ads all the time because that's like the best thing to do, right? And I'm like, well, you got to think about something. So in Google ads, and just this applies to advertising in general, particularly Google ads, there's the ad that you're showing, there's the position that the ad goes in. So for example, you typically now the second ad is actually more profitable than the first ad slot. Why? Because a lot of people think they're slick and they think, oh, I'm not going to click the first one because it's an ad. So they click the second one, not realizing it's also an ad. So there's all kind of freakonomics things going on there and things you learn over time. But the third factor is not only what the ad says, where the ad is positioned, and the third factor is when the ad shows up. That's the one that everybody always forgets. So people, I always tell people, I'm like, look, if you want to be number one in Google ads all the time, that's great. You're going to spend $300,000 a month. That's how much it costs. And so I'm like, you don't want to do that. You want to be just where you need to be when you need to be there. And that's the beauty of Google ads. This gets into the conversation of inbound versus outbound advertising. So inbound is somebody has to take the first step first. That's Google ads. Best dentist near me. They type that out first. Then and only then can I choose to intercept them with a very cheap ad. Outbound advertising is pretty much everything else. TV, radio, billboard. I have to create what sometimes amounts to a quite expensive piece of media and then pay to distribute that, be it mail, cable channels, online advertising, whatever. And that can get really expensive. And, to further answer your question, you also got to think about the psychology of each platform within healthcare or dentistry. To Jeff's point, one of the things that I always found funny, and I'm not even bashing anybody, I just think it's interesting because you do have a lot of companies, I work with them myself. They would work with my dental practices and then they would work with like the hamburger shop down the street. And, one day I was like, what do they really know? They kept coming to me talking about, clients, customers. I'm like, man, I don't have customers. I have patients. Let's just start there. And I wasn't trying to be a dick. I'm just saying, like, if we can't get that right, where are we? Where are we really?
Yeah.
What are we?
So important.
But specific to channel, and this is kind of a joke, but I really feel this way. I mean, when is the last time that you went on Facebook to search for a dentist? Never. Not one single time. People go on Facebook to look at cats and look at pictures of their nieces. That's it. Those are the only two reasons people use Facebook. I'm kidding. But that's, it's kind of true. And so you have to then, if you're going to do outbound advertising in 2024, it's got to be a really good freaking story. It's exactly what we talked about last time. You got to have a great story. You got to have something that's going to intercept them. And still, frankly, I think targeting moms is great, depending on what treatment you're trying to target. The other concept, I always ask people if they've ever seen the movie Moneyball with Brad Pitt and Jonah Hill. And in that movie, they weren't buying the blue chip players. They were buying the players that could run from home to first the fastest. And they would only have them do that one thing. And that's exactly how I think of advertising now in 2024, because everyone has the same problem. Everyone has the same question if you're a dentist or you're a doctor. I want to spend $5,000 a month, whatever their budget is, and I want to get the most money possible from my budget. Okay, so that just cut out probably 85% of all of the possible marketing things that you could do. That's number one. Number two, and there's a good reason for that. I mean, a lot of marketing is just wasteful. Just to be honest, it's just wasteful. You don't need to do it. It's kind of funny because at Rise, like, we now do everything. We do literally every conceivable marketing thing you can imagine, besides like TV and certain things like that, but we can consult on it and contract that or advise or whatever. But if you're running Google ads the right way or Facebook ads the right way, there's an objective right and wrong way to run these things now.